Mr. Sloan. How are you today?
Good, how you doing?
I'm good. My name is Ashley Hope. I'll be your student physical therapist today. So I'll be working with you throughout this treatment session, okay?
Okay.
Before I get started, what we're going to do today requires me to be making contact with you. So is that okay?
Mm-hmm.
All right. First thing we're going to do is called manual lymph drainage. And what that is it requires me to apply some soft or gentle stretches to your skin. And what that will do is increase your lymphatic and circulation flow, increase your lymph production. It's also soothing, so you might want to think of it as a massage. You should just remain relaxed. It should give you some relief from your pain or anything. Okay, so the goal of this is we're just trying to, like I said, increase the lymph fluid, keep it from accumulating here in your left arm, okay?
Okay.
All right, before we get started, though, I have a few questions I will need to ask you.
Mm-hmm.
Do you have any cardiac problems, such as cardiac edema?
No.
Any history, your doctor said anything about a DVT?
Nope.
Any asthma or bronchitis?
Nope.
Okay, renal failure?
Nope.
Any hypertension that your doctor doesn't know about?
Mm-mm.
All right, so before we get started, I'm going to inspect your skin to make sure that there aren't any bruises, signs of infection, anything like that, scarring, open wounds. At the same time, I'm going to do a sensation test. So if you would, just close your eyes and just let me know. Say yes if you feel me touch you. Okay?
Yes. 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 Yes.
Okay. Okay, so we'll go ahead and get started if you don't have any questions for me.
Nope.
Okay, so you, like I said, you just remain relaxed and we'll go ahead and do it.
Okay.
I'm going to try my best not to talk to you so you can relax, okay?
All right.
My hand is warming up for you. Just relax your arm for me. And then I'll be touching the inner thigh here. Mr. Sloan, that completes this portion of the session. How are you feeling now?
Good.
Okay, let me check your skin, make sure that I didn't apply too much pressure. I don't see any kind of increased redness or anything. As far as skincare, you want to make sure that you keep this arm moisturized. You can use Eucerin, Aveeno. Make sure that it's a hypoallergenic lotion, okay? Anytime before you, which is what we're going to do next, is compression bandaging, you make sure that it's moisturized. Also be mindful of tight-fitting clothes. That could increase your symptoms. You don't want to do that, especially around the chest. No hot showers. Be warm. When you're taking a shower, be mindful of scrubbing, just like gentle wiping of it. Any lotions or anything, make sure they're all unscented with, as again, hypoallergenic. And if you're ever doing a blood pressure measurement, make sure that you're doing it on the opposite arm, okay? All right, do you have any questions before we get into compression bandaging?
Nope.
All right, so I'm going to go ahead and let you get dressed, and we'll go on to the next thing.
Okay.
All right, Mr. Sloan, now we're going to go to this compression bandaging, okay? So, again, how are you feeling now?
Good.
Okay, I had already inspect your skin. Just make sure before you ever apply your bandages that you always inspect your skin. Make sure there's not any open wounds, any kind of increased redness or anything. Okay, but before we do the bandaging, let me ask you a couple of more questions. I know you said you didn't have a history of a DVT or anything, any cardiac problems such as congestive heart failure. Has your doctor said anything to you about your ABI being less than 0.8?
Nope.
Okay, do you have a history of varicose veins?
Nope.
And have you had any recent fractures that I need to know about?
Nope.
Okay. Okay, your sensation and everything was intact. So as far as that, we'll go ahead and get started. Do you have any questions for me?
No.
Okay. If you're uncomfortable at any time, just let me know.
Okay.
This first sleeve, this is a sleeve or a stockinette that we use, okay? With the compression bandaging, what you want to do is make sure that these bandages are increasing your lymph flow, helping support your muscle elasticity, increasing your lymph fluid production, and helping get flow and keep it from accumulating in your arm.
Okay.
So, first thing you will apply is your stockinette. And I'll just put this on. Let's try another side here. I think I got the wrong one. And at first, we're just going to start with it folded back. First type of bandaging that we use is finger gauze. You just applying this around your fingers. This is used just for protection of your fingers. So you can just relax. And when you're doing it, you want to make sure that you are rolling off. It helps get a better effect or result. And when you go into your fingers, you want to make sure that you start at the distal end. And work your way back in. And as you do your wrapping, you want to keep in mind not to do it so tight. So you keep an eye on your fingertips. Make sure that they're not turning blue, which could indicate decreased circulation.
Okay.
How are you feeling? Is it too tight for you?
No, it's comfortable.
All right. Okay, and then just since we have this little bit left over, we'll just finish it off by rolling it up your arm.
Okay.
Okay, and when you're doing it, you want to make sure that you're not covering up your palm. So that looks good. Can you make a fist for me? And are you able to
Yep.
feel this? Okay. All right. So next thing, we'll go ahead and bring your sleeve down. Next thing we use is this foam padding. What this is used for is, again, just to help decrease the risk of any kind of injury to your arm. Also, using this, we are going to make sure that your forearm here is the same size as your upper arm, okay? And again, just make sure that you're rolling off. So you can just make a fist here. When you get into the indentation here, the crease at your elbow, you can make a fold like this just to keep it even.
Okay.
If you like. Everything looks good there. How are you feeling now?
Good.
Okay. Okay. The next step is the short stretch bandages. These are used for the compression part. So the pressure will be more here towards your hand than it is here at your upper arm, and this is to help force that lymph fluid back up out of your arm. Okay. So I'm going to have you to spread your fingers out against my chest for me. And again, make sure that you are rolling off. So we're going to start here at your wrist. And once we come into the palm, here at your thumb, we're just going to pinch here so that it goes through that crease nicely. And then you want to make sure that you make about 3 rounds through your thumb before you start to proceed up your arm.
Okay.
Okay, and then once you do that, you start to go up your arm. I'm going to just do overlapping it halfway, just since it's this first time. The more overlap you have, is the more pressure is applied. So you can just press into the chest. Okay, so when you start a new wrap, you want to make sure you're going in the opposite direction. So we're going to start off, I'm going to be going the other way. And once you get to your elbow, in order to make sure that you're able to still move it, you're going to want to go above it, and then you can come back and you're just going, and then you're going to cover it up. So I'm going to have you bend your elbow for me so I can make sure that you can still move it, okay? And then I'm just going to go and fill in that space for you.
Okay.
Okay, again, make sure that you're going in, starting in the opposite direction with the new wrap. And how are you doing so far?
Good.
It's not too tight for you?
Nah.
Okay. we're going to use the tape. You don't want to make sure you don't use the pins or the clips that come with it because you don't want to puncture it. As far as skincare, again, make sure you're using a hypoallergenic lotions. To wash your garments, use it on a gentle cycle. You're going to get two, one that you can wear every day, one that you can wash. When you're on long rides or airplanes, make sure that you have this on. When you're showering, you can cover it with a plastic bag because you don't want to take it off. Do you have any questions for me?
No.
All right, so let me make sure that you can make a fist. Turn your hand over. I don't see any kind of bluing. So everything looks good, so I will see you next time.
Okay, thank you.
You're welcome.